The Michael Berry Show.
This weekend, I was drafting in my mind a post for Facebook about Kleenex and how amazing Kleenex is. And then I thought I would tie it into a larger issue of sinus and snot. And, how doctors will refer to when you blow your nose, is there a lot of good snot that comes out? Is that productive? And I always thought, I love that. That's such a good way to describe that. And so it was the spring of 2020, and I happened to spot something on Twitter about a woman who, her nickname, you have Dr. Pimple Popper, she was Dr. Snot Sucker. And it was about her doing procedures. She's an otolaryngologist. Remember, she got upset if I didn't say that properly. She got upset at me for a lot of things. But so she was dealing with, she was pulling people's snot out of their nose. If you're a career allergy, a lifelong allergy sufferer, you appreciate this. So we had her on and we had a good rapport. And gosh, that's now been 6 years. It's hard to believe. And a lot would happen. Over the coming months, she would become, if not the foremost doctor bucking the medical establishment over how COVID was to be treated, then certainly one of the top three. They came after her medical license. They tried to bankrupt her. They sued her. They attacked her. They revoked her privileges at the largest, most powerful healthcare system. And all the while, it's one of those deals. It's like Silkwood. You mess with the wrong person. And each time she just becomes more and more emboldened. And she starts building this growing army of people who realize, wait a second, 6 feet is stupid. Wait a minute, you shouldn't get this shot. Wait a minute. And so she has grown to be very close personal friend of Robert F. Kennedy and his vice presidential candidate, who was the ex-wife of the founder of Google. She gives speeches all over the country. She's written a book. She has a Twitter following that is massive. It's interesting because had it not been for COVID, I think she would have had a traditional practice and she'd been treating patients and probably been a lot less stressed out, a lot less worried about it all, but thank goodness she was there. And so we've kind of watched her ascendance to this titan that she has become. Mary Talley Bowden, welcome to the program.
Thanks for having me, Michael.
You always act like I'm about to say something that's going to be bad.
Yeah.
You posted the other day, we now have 4,551 peer-reviewed published studies detailing adverse reactions from the mRNA shots. We're talking about the COVID shots. And you're talking about how many people are injured or die, I believe my brother being one of them, from the shot. 4,551 peer-reviewed published studies. Let's start with an overview of what's wrong with the mRNA shot. What's wrong with that COVID shot?
It is not like any other vaccine on the market. I don't call it a vaccine. It promotes your body to produce the most toxic part of the virus, the spike protein. And there's no off switch. They said it would stay in the arm. Well, that's been proven wrong. It's distributed like anything that you inject into your body. It goes throughout the entire body. I don't know how they thought they could get away with that. It would just stay in the arm. And what's concerning, we don't have a way to measure the spike protein yet, but we do have a way to measure the antibodies of spike protein. And these antibodies in people that got the shots are staying very, very high years after they got the shots. And some of them, the antibody levels continue to climb. And, COVID is over. I can't remember the last time I treated a COVID patient. So it's not like people are continuing to get COVID infections, and that's why their antibodies are staying high. I have never seen anything like this with any other product on the market, hands down. And any other product would have been pulled a long time ago. There is just absolutely no justification to keep them on the market. 7 million children have gotten these shots this year. And so for those of the people that say, well, it should be a choice, it should not be a choice. It's poison. There's no upside to taking these shots. And children don't have a choice. And, frankly, people are not getting informed consent with these shots because we still have doctors out there pushing them on them. I saw a patient not too long ago whose doctor pushed him to get a COVID and a flu shot on the same day. And he's been on high-dose steroids ever since because of agonizing muscle pain throughout his entire body. So it's still going on, these doctors that are brainwashed and unable to see the truth, and people are not getting informed consent, and people are still getting harmed, and they're very difficult to treat when they are harmed. The government has completely abandoned them. You only have 1 year to file compensation for a claim. And so that time frame is gone for most people. And the manufacturers are protected from liability. There's no recourse, and there's no great treatment out there. It's a huge problem.
Let's define a couple of things because you've forgotten more than any of the rest of us are ever going to know. What is a spike protein, and why is this concerning?
It's the most toxic. It's a toxic part of the virus, and it's unique to this COVID strain. Coronavirus it's not a new virus, but this particular strain of coronavirus is unique. It has a spike protein that has something called a furin cleavage site, which allows it to really penetrate into the tissue. And it's not natural. It's man-made.
Hold right there.
We know that.
Mary Talley Bowden is our guest. We're talking about the COVID shot and how many injuries it has caused already. Mary Talley, I want to go back to the spike protein because this comes up a lot, and I think it's important that we understand exactly what this is. So this is not a naturally occurring thing. This is a man-made thing caused by taking the vaccine or the shot, clot shot. Oh, sorry. This is a man-made thing caused by taking the shot.
Well, the spike protein is in the virus itself. It's the worst part of the virus. The coronavirus in general, as a category, does have spike protein, but this spike protein is a step above. It's more toxic. And then the shot, which I think is a bioweapon, I don't think it makes the body produce spike protein, and there's no off switch, and it gets distributed throughout the entire body. And we don't have a way of measuring spike protein in the body, but we do measure the antibodies, which is the response to spike protein. And what I'm finding is years later, patients' antibody levels continue to stay at very high levels.
And is that in and of itself a bad thing, or is that just indicative of a higher spike protein presence?
Well, some people, they have no symptoms related to it at all. Now, we can't tell what's going on a microscopic level. But I would say the majority of people I'm seeing with these very high spike protein levels have corresponding physical problems that match it. Now, it's muddy. Ideally, we would have a test to actually measure spike protein. So it's an indirect measurement. And I mean, we need more research, but the government is just, shoving this under the rug. We're trying to get the NIH to look into this, but
the same NIH that pushed this shot on everyone.
Well, same NIH, but hopefully better people. I trust Jay Bhattacharya more than I trust the previous.
I suspect there's still some people embedded within That is the organization that was pushing it. That was Fauci's baby. That was Birx's baby. So you do something. At one point, I remember you saying there was a way to check your level of antibodies. What is that?
Right. LabCorp offers a test, and I like LabCorp better than Quest because Quest, the upper limit on Quest is a lot lower. But LabCorp goes up to 25,000, and you don't need a doctor's order to get that test. You can get it on your own. I believe it's $69. But what I'm finding
Hold on
is
before you do that. Can you be clear on what that is? Because I'm going to be overwhelmed with emails, and I'd like to help these people, and I can never do it. And then when I reach out, you don't like to answer that question. So if you call LabCorp and you say you want this $69 test, what is that called?
Okay, I'm going to look it up right now. I'm going to Google LabCorp COVID antibody test just to make sure. I wouldn't call them. I would just go on the website.
And you don't need a doctor's referral to go. Is that because remember we had this issue before as well?
Right. Now, this is what I did. I just put in on my Google search LabCorp COVID antibody test, and it came right up. If you Google that, and you just click on the LabCorp
My
link.
Google's broke.
Okay, well, some other search engine will probably do the same.
LabCorp antibody test. What else was it?
LabCorp COVID antibody test.
LabCorp. We're not all as smart as you, Mary Talley. Oh, I misspelled COVID. I went to Ask Jeeves. All right, let's see. Reliable PCR test results. Oh, my system's running slow. Oh, there it is, $69. Okay. So you just go in and take that. All right. And then you get your result. What then what's a good number? What's anything above is a bad number?
Well, what I am seeing in the patients that did not get the COVID shots and have not had recent COVID infection, the average level is about 1,300.
Okay.
In patients that got the shots, the average level is about 13,000, although that's an underestimation because 7% of the patients that I've tested are above 25,000, so we don't know their true number. But what do you do about that? That's the problem. And so if it's just going to cause anxiety, just don't do it. But if you're having, we don't have a great treatment. I usually start with ivermectin, and that tends to help in the vast majority of people, but I don't know that it's actually clearing the spike protein or lower it. The antibodies tend to come down, but very slowly.
When you say help, what are we trying to do to the spike protein? Are we trying to break it up and pass it out, or what are we trying to do there?
We want to get rid of it from the body.
And how do we do that?
And the problem, the scenario that we're worried about is the body continuing to produce it, because that was what those shots did. They had your body produce the spike protein, and with no clear off switch.
And what do the spike proteins do to you? What harm do they bring you?
Well, the primary thing is damage to the endothelium of the blood vessels, but what we suspect is going on as well is it's causing the body to produce amyloid, and amyloid is a protein that's very difficult to break down, which causes microclotting, which causes sort of the blood flow not to go properly where it needs to go. And so that's and then there's also the issue of cancer, because the COVID shots, they have SV40 in them. SV40 is in there to promote when they're producing the vaccine or the shot to make it, facilitate the production to make it faster. Mm-hmm. But that's also what we call an oncogenic virus. So it promotes cancer. And now the concern is, are we seeing an explosion of cancer from these? And we don't know, because the CDC has not updated our cancer statistics since 2022. So there's, people all over the internet saying they're seeing an explosion in cancer, but the CDC has not released that data.
Wow. Can you hold with us?
Yes.
Is this painful?
No.
Okay. Hold on.
EHS, the 4-hour system from
The Michael Berry Show.
and other leading companies.
Talley Bowden is our guest. She's kind of like like Solzhenitsyn, She's she's or Elie Wiesel. She's sort of a dissident from the medical community that I think long after we're all gone, they'll praise her, as this very brave, courageous, person who stood up to the Salem witch trials. I don't know if I've told you this, Mary Talley Bowden, but you were actually right about something. So when I first started talking to you, and I wasn't doing my wife was doing the neti pot, and then you said, just do the Neoped. It's the easy, or Neil, whatever it's called. And you just put your salt in there and you do it. It's the easiest thing. And I thought, no. So I ended up going and getting the Navage, which is really cool, but it's much more elaborate and takes longer to set up. I'm back to the Neomed now, and it works, and I do it every day, and I absolutely love it. So you were right about something. I'm admitting it.
Yeah, I stand by that recommendation. It's super easy. You just, put your head over the sink, squeeze, and it's done. With the Neomed, you have to sort of do acrobatics to get it in there right.
Yeah.
And then Navage, I bought one of those, and then it broke pretty quickly, and you pay $100 for that. And
yeah.
So, yep, I go with the Neomed.
It's a little more elaborate than it needs to be. So there are a lot of people who, for whatever reason, took at least one of these shots that they called a vaccine that isn't. What are the options to those sorts of people? I guess first is go get your antibody test that we talked about and see if you have the presence of antibodies, which means that you have very likely have the presence of the spike protein. What more can someone do?
Well, I will say that if you are feeling fine and you didn't have any immediate side effects and physically you seem totally fine, and I don't see the point of going and getting that antibody test. But, I think it's helpful if you suspect you have been injured by the shots as just an additional confirmation that that's probably what's going on. And unfortunately, there is not a lot of great treatment. I mean, I usually start with ivermectin. It's super safe, and most people do feel better. If they've been injured, I have seen some, really the best cases I've seen are the people that come in with severe skin rashes, and these came on immediately after the shots. They're intractable. They've tried antihistamines. They've tried steroids. I even had a kid that was on a strong biologic called Xolair, and he still couldn't manage this horrible rash all over his body. And after 3 days of ivermectin, it went away. So when I see things like that, that prompts me to keep trying ivermectin. And it's so safe. People don't have significant side effects. But beyond ivermectin, it gets a lot more complicated.
Okay, well, hold right there. Let's talk about the numbers, because ivermectin is going to be something that most people can use. It went over the counter. I guess it was in September 5th or whatever. But all I hear from people is they can't get it. How does someone get ivermectin? How much should they take?
Yeah, it's frustrating because it's not technically over the counter. It's available without a doctor's prescription, but the pharmacist still has the final say, and unfortunately, most pharmacists still will not dispense it. So they're only, I've heard of one pharmacy in Houston, Goodrich, Goedrich, that will give it to people without any hassle. I have just applied to, I just got a license where I can sell non-prescription medications, but I'm also getting pushback from the distributors on this. So I'm working on that because I don't know that they'll give it to me because I'm not a pharmacist. Honestly, we need the FDA. The FDA should just make it over the counter. That would be the simplest solution because there's states all over the country spending a lot of time and resources passing legislation to make it over the counter, or they can't make it technically over the counter without the FDA, but they're making it available without a prescription. But all the states are running the same problem where the pharmacists are still not on board. So the pharmacists are blocking that. So it's, most people that I talk to are buying it from India, they're buying it from Mexico, and they're buying it from the feed store. So there's a great resource called myfreedoctor.com, and they don't charge. They will do a telemedicine visit for you. They work off of donations only. So if you are able to pay, you can pay, but if you can't, you don't have to. And they have access to a pharmacy that will dispense ivermectin in all 50 states. So that's probably your best option if you're trying to get ivermectin.
And then how much does one take? How many milligrams? How often? Is it a one-time? Is it a long-term?
Yeah, I mean, it varies. I mean, I kind of tailor it towards the severity of symptoms and, are they older and, can they process medications less easily? And but I'll just say, during the pandemic, we were using 0.4 milligrams per kilogram to treat COVID, sometimes higher in more severe cases. And that's generally where I start with an injury, sometimes lower, sometimes higher.
Is there a downside to taking too much ivermectin?
The most common side effect is blurry vision. It's usually, I think it dries out the eyes. Actually, I think that's where the blurriness comes from. And it's something that people notice when they wake up in the morning, and it is temporary. I've never seen anybody have a permanent problem. Some people will get GI distress, but honestly, I see far more issues with just routine antibiotics than I see with ivermectin.
Okay, fair enough. All right. So, and that's usually a one-time treatment of 3 days, or what does that usually look like if we're talking about the numbers?
If we're talking about a severe injury, we're talking months of treatment. It's not a one-and-done thing. Now, I have seen people respond very quickly, but I've seen a lot of people where it's taken a long time. The most difficult cases are neurological. So I've had patients come in with severe tremors after the shots. And whereas ivermectin does tend to help, it's usually not enough. And those are the hardest cases. And I had a 50-year-old woman who was a previous marathon runner, great shape, no issues, shot in the right arm, and her right arm has not stopped shaking for 5 years.
Wow. And
things like that. I had a CEO of a company come in, great health, got the shots. He walked into my office, handed me his card. He goes, "This is my business card." And then he handed me his COVID shot. He's like, "This is the worst mistake I've ever made in my entire life." And he's shaking all day long, and it came on right after the shots, no prior medical history. Lots of really distressing problems like that I'm seeing.
Can you hold with us for just a moment? Mary Talley Bowden, can you hold with us for just a moment?
The Michael Berry Show.
Now only $5.99 each, plus many more.
Why does she always do
fantastic
this?
values. The $1 million record sale at Woolco now.
It ought to be concerning when we're creating a quote-unquote vaccine under the name Operation Warp Speed. We're going to do an open heart surgery on you, and we're going to do it in just a couple of minutes. We're going to make it the fastest ever. Well, why don't you take your time on that? Let's get this right. She is our guest. She has made this her passion in life, and thank goodness she has. Questions, Dr. Mary Talley Bowden. Czar, thank you for having Dr. Bowden back. Question for her: is there any concern with blood donated from people who had the shot? Can the spike protein be transmitted that way?
That was an excellent question. I actually just interviewed one of the spokespeople for an entity called Safe Blood, and there is concern. What you can do, though, in a situation where you think that you might need a blood transfusion, is you can get donor-directed blood. So you can self-donate in advance if possible, or you can find a friend that you trust and have them donate the blood in advance. Interestingly enough, the FDA recommends against this for some unknown reason. But you have the right to do that, and you can definitely add, there are some hospitals that will push back. And if that's the case, then it might be worth going to a different hospital to have the surgery. But there's actually legislation in a couple of states as well looking at this. Should we be testing the blood for people that were vaccinated to make sure it's safe?
Wendy writes, why don't doctors ask patients if they've had the COVID shot? Cardiologists don't even ask if you're having issues, but they definitely see an uptick in cardiovascular issues and clotting. If I were a doctor, I'd want to do my own research and survey with current patients.
Well, the doctors that don't ask are the doctors that probably pushed the shots during the pandemic and now don't want to face the reality. So it's a litmus test, I would say. If you have a doctor that refuses to speak about it or acknowledge it or even entertain the possibility that you might be having an adverse reaction from the shot, I would find a different doctor.
Yeah, I don't think the people who went to Epstein Island multiple times are out speaking on behalf of the dignity of women. I think there's a lot for them to hide, and they hope it just goes away, right?
Mm-hmm.
It's like the Tuskegee Airmen or the Tuskegee syphilis shot. I think they just hope they can cover this thing up and keep on moving down the road. What do you see as the most common long-term problems that the COVID vaccine, quote unquote, occasioned that you did not see in your practice before?
I think the neurological issues are the most concerning. It's what I'm seeing. Now, I attract I don't see the people that are coming in with heart attacks or strokes because I'm an outpatient physician. And I don't see the cancer situation. I don't treat cancer. So, but the people that are injured that are coming to see me, what I'm seeing primarily is neurological issues. So, like I said before, the unexplained tremors, we're seeing rapid onset of Parkinson's, cognitive problems, brain fog, debilitating fatigue. So, and, neurological problems are very difficult to treat.
You're just going to end it there?
Well, you asked me, that's the most common and most concerning thing that I've seen.
Just scanning the emails I'm getting while you're talking, the biggest questions are the Pfizer shot, the Novavax, the Johnson & Johnson. Are you personally noticing a higher propensity for problems with one or the other?
I don't know anybody that's had the Novavax, so maybe that's a good sign. But I mean, no, I would say it's broadly distributed. I don't see as many J&J, but not as many people got the J&J. And J&J, to their credit, that was taken off the market. But in terms of Moderna versus Pfizer, I'm not noticing some huge trend. And the other thing people need to realize is not everybody that got the shot is likely poisoned. I think a lot of them were duds. They required very stringent storage requirements. You had to have a special freezer. So if they were left out of that freezer for a long period of time, it's possible that they just became inert and didn't even do anything. And I don't think all lots are the same. I think they've said that the E lots were worse. But the overwhelming majority of people are probably fine. But there is, a subset of people that have had severe injuries, and it's more than I've seen with any other pharmaceutical product on the market.
Are we talking thalidomide levels?
Yeah, I think we're going to reflect on this in history like we reflect on thalidomide, definitely.
Well, at least we use thalidomide as a case of how careful we need to be before we put a drug on the market. I think there are still a lot of people within the medical establishment, and this is the reason they're coming after you, is because your presence and your voice embarrasses them and shames them for what they did and didn't do, but mostly did do. And it is, I think that's part of the problem. You know, you and I have had this conversation. My mother worshipped doctors. When you went to the doctor, you know, you were out in the waiting room and you were halfway to healthy because the doctor healed you. The doctors were, you know, these were God men. These were special people. And when a doctor told you, doctor says I have to do this, man, you did it because the doctor knows everything and cares. And then to see how many doctors were willing to fall in line, whether for a financial reason or fear of what happened to you, that maybe in a good way. I don't trust my government, and I now don't trust my medical establishment. Doesn't mean I don't have procedures done or consult doctors. Interestingly, the doctors that are my closest friends were not shot pushers. We're quite the opposite. Even people within medical facilities. It is quite interesting. I would like to talk about what I forget his name, the Pakistani guy that was Abbott's henchman that came after you. Can you hang around and talk about your particular case and your particular practice?
Yeah, definitely.
Can you seem a little more excited about it?
Yes, definitely. Thank you.
All right, hang tight. I am reading your emails as they come in, so if you have questions for Mary Talley Bowden, I will do my best to ask those. Coming up, it's an amazing story. They tried to, we need more doctors, not fewer. They tried to make this lady out to be crazy for doing things like patients who were stuck in the hospital and dying, and their spouses would come to her and she would try to help them survive. And you have political and medical establishment people and a lot of overlap, trying to destroy her over this. What kind of monsters are among us? There is nobody. I have not heard a single healthcare professional who will say the vaccine was a good idea today. You had to take it or grandma was going to die. You had to take it or you were going to die. You had to take it or you'd lose your job. Remember? And the only people happy today are those that did not take the shot. The people who did are scared to death, and many people have developed chronic conditions since then. So why is she still being harassed? Let's walk through what has happened to you since you first dared to speak out.
Yeah, well, first, Houston Methodist went after me very publicly. They revoked my privileges, and I found out through a reporter at the Houston Chronicle, not from them. And, they basically tried to publicly shame me and take away my privileges. Then at the same time, I testified on behalf of a patient in Dallas who was on a ventilator. He was chronically ill. They had given up. They were talking hospice, and wife sued the hospital to get ivermectin for him because the hospital refused. And I testified, and it was actually that testimony where they reported me to the medical board, which your speech is protected as it is, but especially in court. But they turned me in the medical board at that point, and then it became a fishing expedition, and they went after me for sending a nurse to the hospital without having hospital privileges. But I had a court order, and the court order said that the hospital, Texas Hughley Hospital, was ordered to grant me access to the ICU without delay. And I submitted all the paperwork. I did it actually twice. They put up roadblocks. They fought tooth and nail. But I got the green light from the attorney saying, yes, you're good to go. You can send the nurse. So send the nurse. She's greeted by the police. She never gets into the hospital. She never gets into the patient's ICU room. She doesn't barge in there. It's very calm. We have it all on video. There was no scene. It was not disruptive. But they said that that by me sending that nurse to the hospital, I was endangering patients, and that I could not be trusted not to do it again. So they went after me. It's been 5-year battle, $250,000 in legal fees. And the sensible thing would have been for me to just pay a fine and move on, but I'm fighting on principle because a doctor should be able to testify in court and not fear retaliation. A patient should not have to sue to get a second opinion, and it should not, cost you over $250,000 to defend yourself. Luckily, I've had people step in to help me for the ongoing fight, so I don't have any legal bills anymore. And I'm going to fight this all the way on principle because if I lose, it sets a pretty bad precedent.
What is all the way? What does that mean? What would be a resolution of your liking?
I just want to clear my name. Right now, I have a permanent mark on my record. It says that if you go to the Texas Medical Board website, you can see that I was publicly reprimanded. It goes on something called the National Practitioner Database, which is a system that any hospital in the country could look up and deny me privileges based on this report on my record. But more important, it sets a precedent, like I said.
No, I understand. I understand the principle. We had a long conversation at our dinner table last night about the issue of principle and Michael T's home from college, and we talked through these things. I think this is an important case study, because it would have been easier for you to just be quiet and go along, and that's what everyone does. I saw a video where somebody was being beaten to death, and a guy was standing over to the side who looked, in another video, looked like he was perfectly able to jump in and help. And he said, "Somebody please help. Somebody please help." And that's kind of what we see. Everybody wants someone else to speak out and do something about it. Do you have hospital privileges today?
No.
Where do you do surgeries?
I have an outpatient surgery center privileges, but.
So what does your practice look like today? I know you always get upset if I tell that you're a practicing doctor because then you get overwhelmed with calls. Let me say this before you answer that. Let me say this to everybody who's listening. So I will speak on your behalf because I feel like I know you pretty well at this point. If you have a medical issue, you can go see Dr. Bowden. You have to do it through the website. You should not go there because you want to spend 4 hours talking about the fight you had with a past doctor over COVID or a book you read or an article you read, because that's not a doctor. That's a talk show host. You can come to me for that. That's not what she's set up for, and then she gets too many of those and it upsets her. Fair?
Yeah, that was more common in the heat of things. Now
Okay.
my practice is normalized. It's mostly ENT, thankfully. So that's what I really like to do. Is
we're saying ENT
ear, nose,
now.
and throat problems.
I went back and read the transcript during the first break of our conversation, and I said, "Why don't you just say you're an ENT instead of otolaryngologist?" Amazing. How
Well, you're
this
still
thing is-
not saying it right, actually.
It doesn't matter. You know what? It doesn't matter. It all comes full circle, doesn't it? So how many patients do you see in a day at Campbell and I-10?
I usually, spend either a morning or an afternoon. So I usually do a half day, and then I spend the rest of my day being a mom and fighting the good fight. So.
And what do you primarily see people for?
A variety of ear, nose, and throat problems, allergies, sinus, sleep apnea, ear infections. I still see acute upper respiratory tract infections that are stubborn and people, are frustrated, that sort of thing.
And what would be the primary reason they're suffering that?
Wait, I couldn't hear that last part.
What would be the primary reason they are suffering that, an acute upper respiratory problem?
Well, it's Well, what I'm seeing, interesting. So steroids became much more widely used during COVID, which was good. I mean, steroids basically during the tail end of COVID, like if you get the COVID infection during things went really south on day 8 of a COVID infection, and that's where steroids really played a vital role. The downside of that is now people are throwing steroids at patients early on in diseases, and that actually exacerbates the problem because steroids limit your ability to fight infection.
Is that
so I'm
prednisone?
seeing complications from overuse.
Can you hang with us for one? I just want to talk about good breathing health. Nothing political. Can you hang out for one more?
I used to do aerobics till I dropped. Then I found
The Michael Berry Show.
I recommend it and use it.
Mary Talley Bowden is our guest. She is a ear, nose, and throat doctor, political dissident, medical dissident, spokesman, author, speaker. If you want to, if you would like to drive your blood pressure to dangerous levels, follow her on Twitter. She is revealing things daily that are almost, it's kind of like when you find out they're spying on you. For many people, it's almost better they don't know because they don't know where to process this, just how to process this. It drives them through. But let's talk about good sinus health and breathing well. We've had this conversation, but it's been a while. Assume nobody's listening that was listening then. Some things that people can do who at this time of year start getting congested and having trouble breathing. Oh, I got to ask you first. So my wife gave me prednisone. We were traveling a few, let's say 3 weeks ago. She gave me prednisone, and I did the morning show, and I felt alive. It was like it was some sort of a speed, and in the middle of the afternoon, I crashed. Is prednisone not a realistic, for people who have to function for a long period of time in a day, is that not a good choice?
Yeah, you should not be just popping prednisone haphazardly.
Yeah,
Sorry.
That's what I do.
You should not be doing that.
Well, but I felt better.
Yeah. Well, yeah, it has its purpose, but it's not one of those that I would say should be over the counter by any means. It lowers your immune system. So, if you are at the start of some sort of illness and you start popping prednisone, you can and that's what I'm seeing, actually. I see patients, they're going to urgent care and they're sick and the doctor's giving them prednisone and then they get a lot sicker. So, I like prednisone in the tail end of a disease, like if you're coughing really hard, you just can't get rid of it, and the virus is gone, you don't have a bacterial infection, but you just have this persistent inflammatory response. That it can be great for that, and it can be great in people that have really bad allergies and the antihistamines aren't working, and it can be a lifesaver, but you got to be careful about just popping a prednisone.
We'll talk about that later. You said to me the very first time I had you on, I said, what's a simple thing everybody can do? And you said a nasal rinse every morning, a couple of minutes in it. And I did not realize how great that advice was. It is the simplest. I'm trying to get Ramon to do it, and his wife does it every morning and swears by it. It is incredible to me what a difference that has made for clearing out my sinuses. You'll be shocked, just a little salt going through your nose, what it does. What are some other things that you recommend for good breathing health?
Yeah, and personally, I have my patients, and if you're allergic to iodine, shellfish, betadine, you can't do this. But I have my patients add a drop or two of betadine and a drop or two of baby shampoo into the salt water. The betadine is an antiseptic, kills everything. That's what we use in surgery. So we prep the skin with betadine because it kills bacteria, viruses, fungi. And then the baby shampoo is a surfactant. It breaks up biofilms. And biofilms, there's like a sheet of bacteria that can form inside your nasal cavity and sinuses and make it hard if you have a persistent infection. That's sort of their defense system. The other component I like with these saline irrigations is xylitol, which is a natural sugar, and it's poisonous to bacteria. It has a decongestant effect and an anti-inflammatory effect. And so you can get salt packets that also have xylitol in them. If the salt packet is just not quite enough, you could try adding the xylitol as well.
But you can't get a salt packet that has the betadine in there?
No, not to my knowledge.
Okay. And how much betadine?
Just a few drops.
And the baby shampoo?
Same thing. I give my patients sort of a pre-mixed bottle and just have them add 2 to 3 drops.
Well, I saw the Talley balm on your site was $34. So I don't even want to imagine what that costs.
That's for multiple. That's for multiple bottles. It's not one bottle.
Are you expensive as a doctor?
Well, I charge $350 for a new patient appointment, and I charge $200 for a follow-up appointment. So I don't know. I think it's you know exactly what you're getting, and it's very transparent, and there's no surprise. You get a receipt, and you can submit that to your insurance company and see if they'll reimburse you.
Are you still doing the paleo diet?
Carnivore?
The carnivore diet? You're basically doing paleo.
I do it intermittently. I know it works. So if I feel like I'm starting to gain weight, I will do it. I did it for 6 months straight, very strictly.
Oh, I know.
And
I had to hear about it every
I lost
day.
15. Well, I lost 15% of my body weight. So it really works.
Are there other good health tips that everybody can put into effect that aren't expensive, easy to implement?
Well, managing your weight is the single most important thing you can do for your health. And as we just mentioned, I'm a big proponent of carnivore. I think it's a lot safer, cheaper, easier than injecting something in your body once a week. And exercise, you never want to do it, but you never regret doing it. And it's the single most effective thing you can do for your mental health is exercise.
I've started taking bourbon almost every day to kill a lot of the viruses and bacteria and things. Are you big on that? Over the counter?
Berberine? I thought that was to lower your blood sugar, but I could be wrong.
Bourbon.
Oh, bourbon.
Yes.
No, that I can't recommend a daily. No.
But a lot of non-drinkers are uptight and unhappy. I know a lot of people, a lot of my fellow bourbon, and I know you don't like my cigar smoking, but we're happy, and there's something to be said for that. Something to be said for that, Mary Talley.
I say that about people that are heavier in weight. They tend to be nicer people in general.
Yeah.
So I get it.
Yeah. 30 seconds. Any regrets during all of this?
No. I'm very, it's been a crazy ride, but I would not do anything differently. And I appreciate you helping me along the way.
That's what friends do. Mary Talley Bowden, thanks for being our guest, dear.
Thanks so much, Michael.
And there you have it. We get to meet so many interesting people, Ramon. Interesting people. Now, they drive me crazy because what I've learned is really, really interesting people. Like if you heard me and Dan Pastorini talking or texting and then talking on the phone last night, you'd think we hate each other. But really, really interesting people, strong personality people that you go, they're not, sometimes they, but you appreciate
like
it.
old times.
Mr. Michael Berry
comes up with us at steak and ale.